I didn't know that after being in a coma for 2 weeks, you lose all kind of muscle mass and everything else.
When he awoke from his coma, he had no voice. He had a flap that had been damaged while he was intubated. It took about 2 weeks for him to regain a lot of memory. We took pictures in and tried to get him reoriented. He could remember where this person lived, but couldn't remember where he lived. And every day it got better and better.
Not having muscle strength, not being able to feed yourself, anything like that. I mean, they fed me. They took great care of me. The nursing staff there was phenomenal. And then on the day I was supposed to be discharged to Cardinal Hill, they had to take me down first for a swallow test. And they took me down for the swallow test. They said, well, you've passed your swallow test. Well, they had already called up to the 8th floor and let them know that I had passed my swallow test. One of my favorite soft drinks is L81. I had been drinking it, but with thickener. So when I got up to the room, they had me a fresh cup of ice with L81 and no thickener. And they said, here, take a big sip of this. And I took a big sip and I went, God, that's good.
It was probably a month and a half before they had said that, they felt he was strong enough to go through with the surgery.
Yeah, because I remember seeing Dr. London at UK, and that's when I first found out I was going to have bypass.
We tend to see a lot of very complex cases, and his was a very complex case. Obviously, he had an incident in the summer because of the ischemia, his muscle not getting enough oxygen from the blood supply. He has a lot of extensive disease, especially for being so young. Unfortunately, we do tend to see more than our fair share, but that's not our common patients. Our common patients tend to be a little bit older, who have multivessel disease, who have been kind of followed, and then they'll come see us. They may have an incident, but it may not be as traumatic as what he experienced. And he's very lucky that he had all those people to support him so that he could get to the hospital and actually recover enough to get to the point where we could operate on him.
Dr. London came in, said what needed to be done, and I said, we won't know till we get in there, but we're looking at maybe 2, 7 or more bypasses, and I didn't know they went that high.
So he has a lot of blockages in the blood vessels that feed the muscle of his heart, and so by the time we were able to optimize him from a medical standpoint to get him to the operating room, his heart function was lower than what it should be. And so he needed that many bypasses because that's how many bypasses he needed to give the blood supply to the muscle of his heart. We just do what they need for us. So if it takes 5 bypasses to get the muscle of his heart the amount of blood supply that it needs to function and for him to have improved survival overall, then that's what he needs. And at that time, that's the only thing we're doing. He's the most important person in that room, at that space, in that time.
She had a way of making you feel like you're a family member. They take care of you like they would a family member, and you feel that.
Yeah.
So I was very, very comfortable with her.
Yeah.
Even the morning of the surgery, I felt like everything was going to be just fine. We both felt, that fear and panic it wasn't there.
No.
She really made us feel like everything was going to be fine.
Yep.
Patient comes first. At the day of surgery, and from the beginning, from that very first interaction, it's about creating that relationship with the patient. And I always tell my patients that they become family. They get to become part of our family, and we become part of their family because it's a journey. And that's just the first day of a very long journey to improve their health and overall survival.
Recovering from all that over here, and it's probably more my fault than anything for not doing enough exercise, I guess. I got up one night and my whole left side was hurting like the dickens. They determined that I had pulmonary embolisms, and that's when I met Dr. Ogunbayo.
They knew right away when he came in that he had been through a lot. Telling the ED staff his story, they knew that he had to see a cardiologist, and so they called us, and I went to see him, probably because he had been quite immobile for a pretty significant amount of time. He ended up having blood clots that traveled to the arteries of his lungs. Unfortunately, one of the clots probably blocked the artery all the way down there, and he was having pretty significant pain. We had to treat that. So again comes the partnership with the doctors over at UK. I'd worked with Dr. London before. I had her personal cell phone number, and so I just picked it up and I called her and I said, "Hey, Dr. London, a patient is here. This is what we're doing. This is what we're changing. This is what we expect." He had an appointment with her a few days after he left the hospital, and so we could coordinate because we changed medications and so on and so forth. He left the hospital feeling much better. The blood clot had been treated. He went and continued his journey into getting better.
It's standard pillow that they have for cardiothoracic surgery at UK. And the pillow, you mainly hold it on you because if you got a cough or sneeze, you want to hold it and put pressure on your chest so it doesn't hurt as bad. When Dr. London came to visit me, I asked her, I said, "I noticed there's a picture of a heart on the other side." I said, "Can you tell me what you did, where the bypasses were and so forth?" And she said, "Sure." And she took a Sharpie, drew where the bypasses were, and then wrote me a nice little note on here, which I thought was really nice. "You're doing great. Keep up the good work, one day at a time, Dr. London." And I thought that was great.
Cardiac surgery is a journey. It's not about just doing the operation and then them going home. It's about the preoperative care, getting them medically optimized, working with the cardiologist, working with therapists before we even get to the operating room. In the operating room, we have a wonderful team that are specialists in what they do. And then post-operatively, the patients are able to go to a floor that's dedicated to cardiac surgery. So the nurses know what's normal. They know how far to push and kind of when to pull back. And then even after they leave the hospital, we call them and they come back to see us, and then we're able to connect them with cardiac rehab like Mr. Combs, and then reconnect with their cardiologist if they're not in-house. And so it's a full journey.
One of the biggest things cardiac rehab does for a patient is gives them peace of mind that they're safe to do activities of daily living, get out and play with their grandkids without worrying about having another event. But it also does really important things, improving the patient's diet, making sure they are adherent to their medicines and they tolerate their medicines well.
And the story and the journey of him recovering from where we pretty much all thought it was a done deal, to getting out of the hospital, getting into rehab, coming back, having his chest cracked open, having the quintuple bypass, making it out of the hospital, getting a blood clot after that, and still standing. I mean, it's just an extraordinary story when you look at it beginning to end. And I say the story continues because he's still in the phase of rehab where he's trying to get his strength back and get to be the person that he was. And every day, that journey continues.